Hey everybody, this is Josh from Upright Health here with Matt.
Hey everybody.
Today we're going to talk about back pain in squatting. So there can be multiple causes of back pain in squats, but we're going to talk about one specific cause of it today that I see a lot. And this is something that we've seen from actually two guys that have come into the gym in about the past month. And these are guys who are squatting a good amount of weight, right? We're talking 200, 300 pounds, but they haven't been able to squat without back pain in a long time. And it kind of almost to them has become normal. You know, you just have back pain after you squat. But that's not normal, okay? We want to make that clear. So we're going to look at what the issue was, and I'm going to break down the ways that we can go about correcting these issues, okay? So first off, I'm going to have Matt we're just going to pretend this is a barbell. You're going to stick that on your back, and we're going to show what the issue is. Now, they were both squatting down below parallel. They had great depth, but they were just really overarching this lower back, okay? This is something that we've talked about before, getting anterior pelvic tilt and overextended in this lumbar spine. And now when we're adding a bunch of weight onto your shoulders, 200 pounds on your shoulders, of course, your spine is not in a good position to handle that.
That's terrible.
A lot of the time this will result in tight front of the hips and a lot of dull ache in your lower back, okay? So to go about correcting this, we're gonna give a few different steps here, okay? Now, number one is that I like to have people start off with getting on the ground on their back and learning how to keep a neutral spine and a flat back while moving out of some hip flexion and hip extension, okay? So we have videos up on the channel. We'll just have Matt show really quick here. We'll have him do a dead bug, okay?
Am I still on the camera there?
You are in the camera still.
All right. So just, what am I doing?
So we'll just do a dead bug, right? So let's do the opposite of that. There you go.
There you go.
Good. And Matt is cueing his abs to stay on. Notice how his lower back stays flat to the ground. He's not letting that lower back arch up. And he's just extending the hip and then bringing it back into flexion. Now, just to make this even easier, Matt can just take out the arms out of this motion, right? And he can just go ahead and extend each leg one at a time. And to even make it a little bit easier than that is he's just going to tap his heel down, keeping the knee bent, okay? And we just call this a heel tap, all right? So getting on your back, learning how to brace while motion is going on at your hips is number one, okay? So practice that. Matt's gonna hop back up. We're gonna go to step number two, which is using a goblet squat. So we all, if you're getting into strength training and everything, it's really fun to put the bar on your back and to try to increase how much weight you're squatting each week. I love it. Matt loves it. But if you're having... What's that?
I wish I could increase the weight.
Yeah. Been at 100 pounds for like a year now. No, but if we're having issues, then we got to take a step back, okay? It only makes sense to do that. You got to check your ego at the door. And we're going to have Matt do a goblet squat. But what he's actually going to do is he's going to just hold that kettlebell out from himself a little bit. Now, a true goblet squat, you'd be here on the chest. When you come out, it's really hard to overextend your back, okay? Because you have to keep tension in your abs to be able to maintain that kettlebell position there. So now we're just practicing grooving this better squat here with the back more flat, with the abs engaged, just like in our dead bug position when we're on the ground. Now we're just mimicking that in an actual squat here, okay? Go ahead and do one more. It just looks lovely. I want to see it again. Okay, great. All right. So that is number two. Number two is doing goblet squats out in front of you, counterbalancing yourself, finding that motion of keeping a neutral pelvis and spine as you're descending down and coming back up. Now, number three is just some actual cues that we'll use to get yourself out of overextension when the bar's on your back. So now we'll go back to pretending this PVC pipe is a bar, And so for these two individuals that we had in the gym, they were actually already started their squat in kind of anterior pelvic tilt with some arching in the lower back. So just some simple cues like, hey, let's force your rib cage down, not letting the shoulders come too far forward. Let's squeeze the butt. And then a big cue that helps some people that are getting into too much overextension is not necessarily sticking the butt back, okay? A lot of the time if you think engaging the squat with sticking the butt back is just going to put you in overextension, especially if you're trying to keep your chest up at the same time, okay? And I'll see this with a lot of female lifters sometimes. Males too. I don't want to get sexist here, but
Yeah, it goes both ways.
yeah, it definitely goes both ways. But just because like a lot of the time we're thinking butt back, chest up, then we get into that broken position, okay? So actually engaging with just thinking, hey, let's, let the hips go, just break at the hips and go down, right? We don't necessarily have to drive that butt back a whole lot. And then Matt's in a much better position. He can keep a neutral spine here, keeps those abs engaged by keeping the ribs down, and he just lets the butt descend how it needs to descend, okay? All right, guys, so this is just, a full approach at fixing that broken squat to hopefully help your back pain. We regress down to just getting on your back and doing some simple ab coordination drills. Get the kettlebell or whatever weight you have to then, groove your pattern to be able to find that squat motion better. And then actually using some cues to when you put the bar back on your back to squat safely and not get that back pain.
Yeah, I think one thing is this is really looking at the coordination side of things. So if there are muscles that are super tight, if your quads, hip flexors are super over engaged and they're shortened, then you would want to address those too. In this case, what we're looking at is these two guys, they didn't really have mobility issues. They were just coordinating the motion incorrectly, and so by correcting that, they fixed their problem. Now, there are plenty of examples of people who have those muscles in just in a shortened position that's kind of forcing them into that anterior pelvic tilt, in which case they definitely need to address those muscles and then work on the coordination issues as well. So if you already have this tight and you start doing dead bugs, you might actually tighten some things up. So you just need to adjust based on what's appropriate for you. Yeah.
All right, guys. Hope that helps. Remember, pain sucks.
Life shouldn't.